I have IBD that I developed in the military. And they told me most people have it when I went to go see my primary care physician there. And so anyway, what I do is I eat a combination of wheat bran, raw oat grouts, sugar cane fiber, because I grow my own sugar cane, and then maybe inulin, in the afternoon. And then I try to eat fermented food. So I make my own milk kefir, water kefir, and kombucha. And then, I've been getting into fermented salted foods like sauerkraut and kimchi. My question is, and like the other person, I go wax and wane. Sometimes it's fine. Sometimes I'm more on the constipated side. Sometimes I'm under stress, then it'll be more loose stools. I do find if I try to push the fiber too much, then I'm going to the bathroom like 5-6 times a day. It's easy, but then you feel like you're living on the toilet. So in terms of, I've kind of front load, I guess, my fiber because I had it to my breakfast cereal, and then maybe inulin in the afternoon. Should I spread this thing out? And then, if you take things like kombucha, do the short chain fatty acids, the acetic acid stuff, does it actually reach the colon, or do you absorb it like in the duodenum?
So thank you for your time in the service. We see a lot of patients from with a military background who do develop IBS, and because that you've been in a very stressful environment at times. And so it's really important that we all remember that early childhood and even adult stressors impact our GI tract. So we do see that very commonly. So one thing that I will also mention is that, sometimes you have constipation, sometimes you have diarrhea. And this is why it's so frustrating. Like you said, that people are spending their day living in the bathroom, and that's not a great way for quality of life. Now, many of you guys who are listening and watching, you guys are doing everything you can. I mean, you guys are here, so you're learning about whole food, plant-based diet. You're trying to eat healthy and trying to do the right things. But sometimes we can still have those fluctuations and changes and sometimes still have the symptoms. So one thing that is okay is it is also okay to take additional medications as needed. For example, I let my patients know that it is safe to take Imodium, for example, an antidiarrheal. If you're doing everything you can with diet and lifestyle, there are going to be triggers or days where you're still going to go frequently. And it is safe to take something like Imodium. We used to think that if we took long-term Imodium or long-term stimulants, if you're constipated, that you would get dependent on it and your GI tract would stop working. But that's not the case. We know that's not true. So it is okay to take an Imodium so that you can get out and go do your activities and not be in the toilet. And conversely, it's okay that if you're still constipated, despite some of these things, to take a stool softener or a stimulant to help you go. Sometimes, like in addition to diet and lifestyle, we need to also use some of the medications and the things that we know that can be helpful. So, that's kind of what I would recommend for that. And I think the only other thing with the kombucha is just be really careful because there can be a lot of sugar in that. So just be mindful how much sugar, and it can be acidic. So I do like kombucha, but I will usually water it down and add a lot of water. So I get some of the health benefits, some of the flavoring, but I'm not overindulging on that too, because too much sugar, of course, will throw off our GI tract. And then I think a theme that I see in my office, and I'm clearly seeing here too, is that it can be very frustrating because the symptoms change. And so to remind yourself that if you've been diagnosed with IBS and everything else has been checked, it's not anything worrisome. IBS in and of itself, although it is uncomfortable and it impacts quality of life, it is not putting you at any increased risk for like a cancer necessarily. It's not, unlike inflammatory bowel disease, where if it's uncontrolled, you can get an increased risk for colon cancer. Irritable bowel syndrome does not do that. So sometimes I think that helps because, even if you don't have IBS, people have fluctuations in diarrhea and constipation. So if you have it, you're just much more likely to get it. And it's not always something that it's always under control. It can flare here and there too. And also many of my patients who've had this have been having symptoms for like 10, 20 years. So just remember that it can also take years to heal. This is not a quick heal.
Excellent, doctor. Thank you very, very much for that. And now we'll go ahead and move on to Tina. Hi, Tina. Welcome.
Hi. I have a different type of question. I had a IBS for years and years, probably about 20 years, and I had my gallbladder removed and had some procedure they did, and it pretty much resolved. But I still have constipation and diarrhea. I still fluctuate between those two, but I don't have the cramping and bloating and the other uncomfortable syndromes that were associated, and I didn't have to take belladonna anymore. And I was just wondering, is there anything I can do about the constipation and diarrhea? I've been doing the whole food, plant-based diet. I haven't had meat in like probably about 6 years now, but I still have my days. I guess I have trouble. Do you have any suggestions?
So it sounds like if you're having the alternating constipation and diarrhea, we would consider that irritable bowel syndrome mixed. And the other thing too is that many times gallbladder symptoms can mask as IBS. So I think it was good that you had that evaluation done, because sometimes if people are having abdominal pain and symptoms, it is a gallbladder issue. That's why it's always important to make sure there's nothing else going on when you're being diagnosed with IBS. So it sounds like you're doing a lot of the right things to help with the irritable bowel, with the plant-based. Sometimes a little bit of additional fiber supplement can be helpful, something like Benefiber, but also that's not very helpful always. Honestly, it sounds like you're doing the right thing with the plant-based diet. It just can take time. And then you would be the right person to take an Imodium as needed, and just pay attention to what other things are going on. Because usually when people switch to the diarrhea side, it's because they're having increased stress and something going on in their lives that are causing the colon to increase the transit time. And then lastly, anybody who's had their gallbladder removed who is having diarrhea should also be checked for something called bile acid diarrhea, because the gallbladder, the function is to store bile. When you do not have your gallbladder, you're no longer storing bile, and the bile is being secreted and excreted into your colon. And that in and of itself can cause diarrhea. So if you haven't been checked for that, you might want to look into that.
Thank you so much for that, doctor. And now we're going to go and head over to Norman. Welcome.
Hi. Thank you for this useful presentation. My question relates to the variation of plants for more diversity of bacteria. I'm healthy, eat only raw whole plants and like mono meals. Is it enough to eat something different each week, or should I try to eat 30 different plants with each meal?
I missed the beginning of your question a little bit. Is your question, is it okay to eat the same fruits and vegetables in a week, or do I recommend you get more diversity? Is that the question?
Yes.
Okay. Yeah. I do recommend a diversity. if you can get a variety, you are feeding a variety of your bacteria so that you're getting the bacteria loving bacteria that's going to love different foods. And we know that variety and diversity in the bacterial strains is important. And the best way to do that is the variety in the foods. It also depends on where people are in their journey. It sounds like you are already eating a predominantly plant-based or a plant-based diet. So then the next step would definitely be to increase variety of grains and vegetables and fruits. If there are people who are on a regular standard Americanized diet who have very little fruits and vegetables, then I would say instead of focusing on variety, just focus on getting in fruits, vegetables, whole grains that you like. Start basic, start with things that you know you will eat. Because if you eat too much variety and you get turned off by it and you want to go back to your processed foods or dairy and meat, then we've not set ourselves up for success. And we really want to do that. So it really depends where you are in the journey. First step is to incorporate more fruits and vegetables. Next step is to minimize and decrease processed foods, meat, dairy. Then I feel like the last step is really to try to diversify.
Again, thank you so much for all of that. And we've got a few minutes left. And so I've got somebody with the first initial G, and welcome.
Yes, I have two questions. One is, are things like shiatsu and qigong and douyin as effective as yoga in your recommendations? They're all calming.
Yeah, sorry, continue.
They're all calming forms. And I do have another question once you've answered that.
So I do think that they are helpful. I think that anything that calms down our brain and our body and our mind and can still that, anything like that is going to be helpful and beneficial. So I would say definitely incorporate that into your lifestyle. That's only going to be helpful. I don't know if there are any specific studies or research trials looking at that. But just because we don't have research trials on those things yet does not mean that they're not helpful. So I would say if it's helping you, definitely I would do those things, because anything that is going to impact the mind, the brain is going to impact the GI tract and will be helpful.
Okay. And my other question was, I've understood from past studying with people, they sometimes recommend chewing foods separately by themselves. And in fact, some people are funny about having foods on the plate next to each other food, but because different enzymes or different something or other like to work on one food, mix them, it's not as effective. I'm not sure what my question is, but it's basically about mixing foods, eating them separately.
I can't comment too much on that. I mean, I've heard some similar theories, and I think that there are some practices that do say that you shouldn't mix certain things. In my, gastroenterology training, we did not learn much about that, and we don't have much advice on that in the medical research in the GI field. So I feel like it's a little bit outside of my area. I wouldn't be able to comment on it. There's nothing in the GI literature that I have studied that specifically says you should not combine certain things, but that does not mean that you shouldn't. There's a lot of other research out there. So I would definitely have to look more into that right now.
Thanks very much, Doctor. We are right up against the clock, but we do have one last question. If we can squeeze it in real quick, I'm going to call Janet, if you can go right ahead.
Hi there. You were talking about the gallbladder, and I'm on a whole food plant-based diet. I am eating like nuts and seeds, flax, chia, and avocado, but finding I can't digest fats anymore. Was just wondering, feeling a bit nauseous, what kind of tests could you get done for your gallbladder? And if you feel it is a gallbladder issue, should you just eliminate all your fats, or are there foods that can help? Thank you.
Yeah, if you think that there's a gallbladder issue, then I would definitely talk. Even a primary care doctor could start by working it up. We usually check liver labs. They might get a right upper quadrant ultrasound, and ultrasound looking just to see, could you have stones? What else is going on in your gallbladder? And then there's a study called a HIDA scan, which very specifically looks to see if the gallbladder is squeezing properly. Because if it's not squeezing symptoms. So we definitely do not want to do any surgery of any sort without, or that we have an issue with the gallbladder. So you can definitely get worked up. And I wouldn't start by eliminating or changing your diet yet until you get it evaluated, because it might not be an issue, and then you've altered your diet and potentially made it more restrictive.